In general, knee pain and common knee conditions often occur due to muscular imbalances, poor patellar mobility. Your patella is your kneecap, and patellar mobility means how well your kneecap is moving. When you bend your knee, your kneecap, your patella should move down. When you extend your knee, your kneecap should be moving back up. Abnormal patellar tracking can also cause knee pain and common knee conditions, and what that means is how well your kneecap is articulating with your femur, your thigh bone. Two common knee conditions that we treat very often at Loudoun Sports Therapy Center are ACL tears and then subsequent surgical repairs, and quad tendon tears and subsequent surgical repairs for those. Your ACL is a ligament. It is a band of dense tissue. A ligament attaches bone to bone. So your ACL runs from your tibia, the front of your tibia, which is your larger lower leg bone, to the back of your femur, which is your large thigh bone. And what it does is it acts as a big knee stabilizer, and it resists anterior translation of the tibia. So if this is my tibia and this is my femur bending at the knee, the ACL prevents the tibia from moving forward too much. There's a little bit of give to it, but it really helps provide that stability to your knee. It also helps prevent too many rotational loads. So when you're planting, changing direction, it helps provide that stability for your knee so you're not getting too much rotation through the knee. Females are 3 to 4 times more likely to sustain an ACL tear in their lives, but the good news is females are also able to reduce that risk of a tear up to 80%, which is huge, with sport-specific training and also injury prevention training, which are two things that we both offer here at LSTC. Your quad tendon attaches muscles to bone. So your quadriceps are 4 muscles that sit on the front of your thigh. Your quad tendon attaches those 4 muscles to your tibia, your lower leg bone here. And that, again, just helps provide tensile strength and more stability for your knee. Some symptoms of instability or tears in these two structures, the ACL and the quad tendon, oftentimes if someone sustains an injury to either one or the other, they'll feel a pop or they'll hear a pop in their knee. Sometimes immediate swelling, bruising, a lot of tenderness, cramping in the knee, loss of range of motion is very common. People who have these two issues, one or the other, feel like their knee is just really unstable. They might have a sense of their knee giving out on them. With a quad tendon tear, you might see a little bit of sagging just above your kneecap, where the tendon actually runs underneath the patella of the kneecap, or a little indentation right above the kneecap. With an injury like this, if you're playing sports, you're not going to be able to continue playing your sport. You're going to have way too much pain. Oftentimes people have a lot of sharp pain just with daily activities, trying to go up and down steps, getting in and out of the car, getting up and down from a chair, even just walking on flat ground can be pretty painful. Squatting, things like that, and then significant weakness too. Causes are muscular imbalance. We see a lot of quad dominant athletes in our clinic, and what that means is you're overusing your quads, and that's going to cause a lot of weakness in the posterior chain. So your glutes, your hamstrings, all those hip stabilizers, the rotators in your hip are going to be very weak. And what that causes is those muscles in the front of your thigh are going to overwork. That can overwork the quad tendon and make it, can give you tendinitis, and that's going to weaken it over time and make it more susceptible to injury. Some other causes of these issues, an ACL tear or a quad tendon tear, include, like I said before, chronic tendinitis, and tendinitis is going to be that inflammation of the tendon. So overusing your quads is going to make them weaker, inflamed over time, and make you more susceptible to injury. Any kind of trauma, football players getting tackled, any kind of high impact sports, a direct blow to the knee can definitely put you at a big risk for an ACL tear or a quad tendon repair or tear. Pivoting on your foot. If your foot is planted and you go to pivot, that's going to put a lot of torque on your knee. Athletes who are jumping a lot, especially we see this a lot in basketball players and volleyball players, if you're not landing correctly, the mechanics of your hips and your knees can put too much torque on your knee. A sudden deceleration. A lot of sports involve running and sudden stopping. If the ref blows the whistle, you have to stop all of a sudden. That deceleration can cause your knee to actually hyperextend and rotate too much, and that's going to put too much torque on your knee and can really damage these two structures. PT can definitely help you address both of these issues. A lot of times an ACL tear or a quad tendon tear can be minor. It can be a partial tear, and in those instances, surgical repair is not necessarily necessary. If you try PT first, a lot of times you can build up enough strength for the tear, the small tear or partial tear, to actually repair itself over time. Even if you do require surgery, doing PT before surgery is really important. It'll give you a little bit more range of motion before your surgery. It'll get you stronger, so then after your surgery, you'll have a better result. PT, what we do to help with these issues is we're going to help with your swelling. So we're going to manage that edema, that swelling, that bruising that you have. And then once we reduce the swelling, we can start to do a little bit more range of motion, a little bit more stretching with you. And then once some of those more acute symptoms have subsided, then we can start some strengthening. We'll start with basic strengthening, foundational exercises, and then we'll build from there, getting you back to more functional activities, making sure that your gait pattern is correct. You're able to go up and down the steps, get in and out of the car, all those functional activities, and then we'll progress you from there, getting back to your recreational activities. If you play sports, definitely sport-specific training with our athletic trainers, getting you back to doing what you love. If you're dealing with any type of knee pain, an ACL tear or a quad tendon tear, any type of knee condition at all, give us a call. Our phone number is 703-450-4300, or click the link below for more information.